Health. Thank you for joining us for our COVID-19 Thursday update call. I'm joined today by Secretary of Health Kim Malcolm-Risden and Dr. Joshua Clayton, State Epidemiologist. Dr. Clayton will give today's update, and then we will take your questions. I do want to just make an announcement here at the beginning, and I'll make it again at the end, that we will not be holding a briefing next Monday, but we will be rescheduling for Tuesday, September 8th. So no briefing on Monday for the holiday, but we will do a briefing on Tuesday, along with our normally scheduled Thursday briefing next week. So with that, I'll turn it over to Dr. Clayton, and he'll give today's update.
All right, good morning, everyone. Today we are reporting 334 new cases of COVID-19 in the state. This does include 9 new hospitalizations, 0 new deaths, 196 individuals who have recovered to the point where they are no longer able to transmit COVID-19, and 2,449 new tests that have been reported to the South Dakota Department of Health. This does bring our total COVID-19 case count in the state to 14,337. Of those, 3,013 are considered active infections. 11,155 individuals have recovered. We currently have 76 individuals who are hospitalized, and the total number of deaths is 169. And we've had a total number of tests reported to the South Dakota Department of Health, 198,749, and that is among 150,538 unique persons. Just a few other information updates. So for the number of Sturgis Rally cases that have been identified as part of our cluster updates, we have 118 South Dakota residents that have a history of attending the Sturgis Rally. And we do have just a general breakdown of hospitalizations by month, which is something that we had talked about on our last update. So I'll just run down these numbers, and then we'll go ahead and also get a quick posting to the Department of Health website. The number of hospitalizations, 18 in March, 187 in April, 259 in May, 229 in June, 153 in July, and 200 in August. So just wanted to provide those numbers, and you can see that we have had higher hospitalizations than we did in August, both in May and June. And with the case increases, we continue to be vigilant for hospitalizations as well as death reporting to the Department of Health.
With that, I'll unmute the lines, and then we'll take your questions. We're ready for your questions.
Yes, Ben with the Daily Plainsman in here. Ben with the Daily Plainsman in Huron.
Go ahead, Ben.
Yes, just curious if with Monday being a holiday with the school information, is that going to be posted still Monday, or will that be delayed?
So that information will be delayed until Tuesday as well, as part of our updates. Yep, thank you for the question.
JPKON News Radio.
JP.
Thank you very much. Say, I noticed that your numbers of the COVID-19 cases with the K through 12 schools for the week of August 23rd through the 29th, those are still provisional. Do you plan on updating those?
We update those weekly, and all of our data is considered provisional until it is finalized at the end of the year. And oftentimes that process of finalizing cases with CDC takes until the middle part of the year. So we'll be finalizing our case numbers is what we have as a final data set between ourselves and between CDC, usually by June. So it'll be June of 2021. And then the finalized case numbers for 2020 will be reported usually around November of 2021 with the annual disease reports.
JP, this is Secretary Malcolm-Risden, but we will make updates to that provisional information as we get additional information, and so you'll see updates that we've made along the way, you know, counties of residence, other kind of demographic data as we work through those processes as well.
Yep, both on the dashboard as well as in that file relating to cases within K through 12 schools and colleges and universities and technical colleges. Yep.
Will you have the K through 12 results ready on Friday for this past week?
So the data is actually a calendar week, so we go Sunday through Saturday. So with that in mind, we do cut the data on 1 p.m. on Sunday for everything that's been reported to the Department of Health through that previous Saturday. And so we'll then work to get those numbers updated, and we'll push it out the same day that we have our media briefing next week.
Thanks.
Lee Strubinger,
Morgan at the Rapid City Journal. Sorry.
We'll go to Lee and then to Morgan.
Cool, thank you. I was just wondering if y'all could tell me how the state is approaching contact tracing for the 118 Sturgis cases, and how are there concerns about sort of secondary cases coming, from those 118, and I guess how many Department of Health employees are doing that contact tracing?
Lee, this is Secretary Malsom Ryston. So again, the 118 are South Dakota residents, and so we are, actively investigating those as we would any other case involving a South Dakota resident. That process includes an initial interview where we gather information about where the person might have been. You put out some public notices related to Sturgis activities when people have been in situations where they can't identify individuals that they've been in close contact with, part of that process. And then as we identify those individual close contacts, then we work to notify those individuals that they are being directed to quarantine for 14 days because they're a close contact. So it really works the same with this population as it would with anyone else. I see Derek pulling up our latest numbers. We have surged our staff here in recent days as we've seen our cases increase. And so we'll get you that number here in a minute. Did you pull that, Derek?
Yes, we have surged to 211, the total number of people since the beginning of the spot response who've been doing contact tracing for us is now 243.
So Lee, we can follow up with you and let you know how much of a surge that is from where we started, but
Originally started at 131.
okay, there you go.
I didn't catch that number because someone wasn't on mute and really trashed my audio. Could you say that number again of how many people were?
We have 243 that are currently doing contact tracing, and we started at 131.
And that
Thank you.
includes the investigation process as well.
Next question.
This is Stephen Gross from the AP.
Go ahead, Stephen. And then we'll come back to Maureen. All right.
Yeah, so, I understand that really watching the number of hospitalizations and the number of deaths is kind of the bottom line for the Department of Health. I'm wondering what you would say with, South Dakota having one of the highest spreads in the country currently. How much do the number of infections down the line affect the number of hospitalizations and deaths? And, will it be too late to act once the number of hospitalizations and deaths start to rise?
So we do typically see a little bit of a delay in terms of increasing cases and increasing hospitalizations and deaths. That is about a 2-week delay from that first increase in cases to that when we could expect increase in cases within our hospitalizations. And so, we do continue to be vigilant in working with our healthcare partners, health system partners, to make sure that we have the capacity to be able to respond. But as we mentioned, we have 76 individuals who are currently hospitalized today, and that represents just a fraction of the current total capacity within the healthcare system. And so, we do continue to work with them to be prepared for any potential increases that we may see from this. And the focus, again, is the Department of Health tries to, through our process of case investigation, contact notification, issue of notices to individual to isolate and quarantine, and again, recommendations for individual is the totality of the focus of reducing COVID-19 transmission within the state.
Stephen, the other thing I would add as the Secretary Malcolm-Reisen is that, we also do monitor some of the demographics around those increases in cases. And so as we see increases in cases among younger people, we do generally having a lower hospitalization rate. We shared that data on a prior call. So that, again, it's quite disproportionate, so that we've seen, I want to say, just over 10% of all hospitalizations among people that are under age 30. So as we see more cases in that group, it's not a one-for-one rate of hospitalization with those younger people.
And now we'll go to Morgan with Rapid City.
Sorry, can I just follow up on that?
Sure.
So, I'm wondering, I understand that there's a lower hospitalization rate among younger people. Is there a concern that those people who might be carrying infections potentially spread that to people who are more vulnerable? And, with the potential for an increase in hospitalizations being 2 weeks out, is there a cause for concern or alarm among South Dakota residents? Do we need to double down in our efforts to stop the spread of the coronavirus?
Oh, Stephen, I think, you really hit the nail on the head in terms of why we do the investigation and contact tracing process, and that is to minimize the spread. And, again, the recommendations for individuals remain the same. And that is to stay away from other people, keep 6 feet of distance whenever possible. If that's not possible, consider wearing a mask. Wash your hands. It's still the number one thing we can be doing, and wash them often and wash them for 20 seconds for each time. So those recommendations are all very valid, and they remain the same. If you're an individual in a higher risk group, and that would be people that are older, that have underlying health conditions, you really need to be careful, and that remains the same as well. And so those messages are still appropriate, and we appreciate your help.
And now we'll go to Morgan, and I'll just remind folks to put your phone on mute if you're not asking a question.
Thank you. Yeah. I had kind of the same question as Lee, but I'm just wondering, for the recent jump in the active cases statewide, is the Department of Health able to keep up with the contact trace? For example, I've heard, anecdotally through friends and people that, they've gotten sick, and then they don't hear from you guys for, a week or, the day that they get their positive results that come in late, they finally, hear from you guys. So, I don't know. Maybe you can, kind of talk about why that is.
So, Morgan, I would tell you that obviously when we have more volume, it does increase the challenge of keeping up with cases. But that's why we've surged over 100 people to help us with this response. So that has very much contributed us to being able to keep up. One thing that we do continue to struggle with, and we talked about this in the past, is needing to make multiple contacts to people before we're able to reach them. And so, again, anything you in the media can do to help encourage people to pick up the phone when we call or when we leave a message, because that's what we do, when we can't reach somebody initially, please call us back so we can get you the information that you need to stay safe. We have lots and lots of situations when we get any kind of information that says, hey, why did it take this long, and in the instance that you just shared, to actually reach someone. We'll look into every single one of those and make sure that we're doing everything that we can to make timely contact. More often than not, we find situations where we've made 5, 6, 8, 9 contacts to a person before they've actually been, able to be reached and discuss the situation with them. And so when we have that going on, it will delay because we just can't get a hold of folks.
And then I have a second question. A reader asked about this. Do the case numbers for the state factor in, people who may be at the VA or something?
Are you asking if they include people from the VA?
Yeah, like people that are staying there or working there, they were curious about if the state counts those the same way, if they're living in the state. I don't know.
Yeah, so the Indian Health Service, all of their service units, all of the VA hospitals and clinics that might be doing COVID-19 testing, they are reporting those cases to the South Dakota Department of Health. And we have a couple different ways that they can do so to make sure that we get that information in a timely manner. And the focus is, we work them the same way as we do all of the other cases that we do get in, that if they're South Dakota residents, they are worked by our case investigators, and those contacts notified. And if they're from out of state, for the cases that we do receive in that respect, that it does take us, just a moment to get those over to the respective states so that they can conduct those investigations. But yeah, the VA is a partner that works with us to make sure that we get all those cases reported.
Next question.
Ray from Keloland. Ray
Hi
from
there.
Keloland.
Oh,
Ray
Ray.
from Keloland.
Ray.
Hi. Hey, in mid-June, Dr. Clayton, you said that there wouldn't be any statewide peaks, but there'd be like a series of peaks and valleys. And I'm wondering if what we're seeing today is what you would have anticipated in mid-June.
I certainly was not wanting to see this high level of cases, but this is definitely possible, within the realm of possibility of what I was thinking when we were talking about seeing increasing cases of when individuals are coming together and not taking individual precautions to avoid spread. And I think some of that has occurred as the summer is nearing the end, and individuals are focusing on how best to spend the remainder of their summer, and wanting to get with friends that they may not have had a chance to earlier on. So the kind of behavioral side of things, I think, has been playing a role in the current levels of transmission that we've seen in the state, and the increasing cases that offer a good reminder for individuals to focus on what really have been our core ways to reduce transmission, which is that focus on appropriate hand hygiene, wearing a mask, physically distancing from others for greater than 6 feet, and so on. And so, yeah, this is, I think, reminiscent of what we can and what we will see if we have individuals who are not taking those precautions.
So just a quick follow-up, if I could. Governor Noem recently shared a Twitter post on an article about herd immunity, and she's made some references to that. Herd immunity, would that indicate that herd immunity is a possible public health goal for the state of South Dakota?
Ray, I don't know that we've seen necessarily the article that you're referencing there, but I can tell you that in addition to looking at herd immunity and the science around what levels we might start to do that, we're also actively gearing up for vaccination, which is a very exciting development, and we're actively preparing for the day when we have a safe and effective vaccine, and that will be sooner rather than later.
Next question.
Thank you.
Hi, Megan Morath, News Center 1.
I heard News Center 1.
Yes. So you mentioned in the projections and the numbers that we're looking at now, some peaks and valleys. But has the state or any of the healthcare systems collaborated on a new curve similar to what we saw earlier in the year? So, like, what is the state looking for or looking at or anticipating as far as hospitalizations, overall numbers going into the fall? And does that include school, flu, et cetera, that kind of thing?
Yeah, so this is Dr. Clayton. We do have meetings regularly with the individuals that are working on different modeling, specifically around their hospitalization and their capacity. And so we continue to, work with them and have discussions, but I would have to refer you to individual facilities that, might be doing some of that. That's not something that the state has continued to maintain as we've had that focus of working with those health systems to make sure that they have what they need to appropriately manage the number of COVID cases as well as other cases, other hospitalizations that they might be seeing within their facilities.
Can you speak at all to some of those numbers? So from a state response, what are you getting ready for?
Again, I would have to refer you, we have discussions and we provide data to the health systems, but as far as individual numbers or their modeling outputs, I would refer you to those the health systems.
Next question.
KPKOR News Radio.
I'm going to go to somebody who hasn't asked a question yet. Somebody other than JP, sorry.
Mark from the Pioneer.
Go ahead, Mark.
Can you better define a Sturgis rally case? Is it somebody who visited Sturgis proper during the rally? Can you just better define that?
Yeah, so what we're considering as far as our Sturgis, the cases associated with the Sturgis Motorcycle Rally are individuals who are state of South Dakota residents who in the 14 days prior to their illness onset had visited the Sturgis or the larger or attended an event that would be considered part of the Sturgis Motorcycle Rally prior to their illness. And then upon identification of their illness, those individuals provided us with that history of exposure at the Sturgis Rally.
So then somebody who did not visit Sturgis or one of the rally camps would not be considered a Sturgis Rally case. And then, for example, if a guy attended the rally, got sick at the rally, went home, got his wife sick, she would not be considered a rally statistic. Is that correct?
That is correct. That we are looking at those individual cases that arose specifically from exposure at the rally, and not potential secondary transmission within households or other settings of the cases that had attended the rally.
Next question.
Coda? Jen from NBC.
Go ahead, NBC.
Hi. I was just wondering if the Trump administration has ever rescinded guidance that has been sent to the South Dakota Department of Health. Specifically, I'm interested in the CDC guidance that was sent back in April for the Smithfield plant.
This is Secretary Malcolm Reisden. I'm not aware of any rescindence of guidance. We worked closely with the CDC, as you may be aware, to help the folks at Smithfield develop recommendations around mitigation. And so I think it was a great process and worked fine.
And this is Dr. Clayton. Specifically, CDC guidance that existed at the time in April when we were identifying cases at the meat processing facility, specifically were focused on critical infrastructure guidance that was available in the first part of the month. And then at the tail end of the month, there was specific guidance for meat processing facilities. And so, those are specific guidance that have been available not only to South Dakota but to other states as well to mitigate any risk of spread of COVID-19 within those meat processing facilities.
Next question.
Anderly with Coda.
Go ahead.
Hi. So we have one of the highest percentage rates in the country. Can you just get a reaction to the large influx in cases in the past couple weeks?
Well, again, as we've shared on previous calls and even today, we have seen an increase over the last week. We have shared some demographic data around that, and whenever we see people coming into contact with each other, whether that's related to schools or universities reopening or events in communities, or even family celebrations like we may be seeing over Labor Day, it's the expectation that we will see more exposures and potentially more cases. And so we're reminding people to continue to take personal responsibility, do what they can to stay away from others and reduce their potential exposures to minimize the spread.
Next question.
This is Jonathan with the Argus Leader.
Go ahead, Jonathan.
Thanks. Has the Department of Health given any of the universities any kind of specific recommendations on how they sort of rein in the cases that they're seeing?
Yeah, so Jonathan, this is Kim again. Sure that they understand the guidance that's available, understand different mitigation strategies. We've reviewed several aspects of their plans as they've been working on them throughout the summer months, and continue to have ongoing communication with that group. In fact, have a call with several universities this afternoon to talk about testing and different ways testing can be a part of the mitigation work that they are doing. I think you can appreciate that each campus, just based on their population and their how they're set up, has a plan that's unique to their own situation. And I would tell you that we feel, our team here at DOH feels that the universities are taking this very seriously and being proactive in trying to address COVID on their campuses.
Okay, we have time for one final question.
JP KOA News Radio.
Go ahead, JP.
Thank you. Centers for Disease Control is telling states to be ready to distribute COVID-19 vaccines on November 1st. How is South Dakota going about preparing for that?
Well, thank you, JP. That is certainly a bright spot in the entire COVID response, and we're excited to see a safe and effective vaccine coming to states. The way that we are planning is by working with our partners, including the healthcare systems in the state, as well as other providers, especially long-term care, because we expect that the allocation that we will get, as will be the same in every other state, will be geared towards specific populations that are at higher risk for adverse health outcomes if they contract COVID. And so we are preparing those discussions, anticipate being able to do some mass vaccination with specific populations. That activity will really be determined by the amount of vaccine that we're able to get, which we do not know yet. But nevertheless, the conversations with our healthcare partners are ongoing so that we are prepared. And we've got a good track record in South Dakota when we needed to do mass vaccination of people for the H1N1 pandemic. We had a great response, and that was really because of the hard work of healthcare providers across our state. So we're kind of dusting off those plans, seeing what can work for COVID, and kind of going from there.
All right, thank you all for joining us.
Can I ask one quick question?
Sure.
Kim, can you just kind of maybe say what populations might be getting that vaccine first, if possible, or?
Well, we do not know for sure, but we do know that there's been a lot of discussion around people in long-term care facilities as being very vulnerable. That's been a big, target population at the federal level and the state level. You'll remember we've done mass testing with that group. We're continuing to do sentinel testing and, really actively working to hopefully mitigate any COVID within that population. Other groups that have been discussed, but again, this is not final, include healthcare workers because they are on the front line, and other vulnerable people because of their health status. So more to come on that, and again, we're excited to be moving into that.
All right, thank you all for